Hi there. I'm here today with Dave Maffio, Senior Director of Support Services. In his role at Boston Medical Center, he's responsible for two critically important teams in our fight against the COVID-19 pandemic: environmental services and dietary. So on a good day, Dave, you're responsible for keeping the 10,000 people on this campus safe and well-fed, and keeping our environment clean and supportive of our patient care. The stakes around that work has really ramped up with this pandemic. So could you talk a little bit, not only about environmental services and dietary, but all of the support service departments and how they're working differently in this pandemic to support our staff and our patients?
Sure. So, in terms of environmental services, this is an environmental disease that we have to make sure we stay ahead of. So, I'm so proud of the work that they do every day, staying ahead of the cleaning protocols, being vigilant and diligent, and the management teams work extremely hard to make sure we stay ahead of it.
Say one more word about the cleaning protocols, because just like PPE, the cleaning protocols change, and our guidance to staff changes fairly regularly. So could you say more about how you get that information out in the many languages that we that work here at our hospital?
Sure. So, we're working closely with infectious disease on how this is ever changing. They come to our huddles as well as clinical educators. So, they're teaching our staff, they're supporting our staff, they're letting them know how to be vigilant in the work that they do. There's certain chemicals that kill COVID, and we stay ahead of what those chemicals are, and we educate to contact times to our staff and the efficient cleaning of the patient rooms.
That's terrific. So my dad would say an army marches on its stomach. So talk to me a little bit about the team in dietary,
Yeah,
because
so
their work has totally changed.
yes, great point. So, on a regular day, we'd have 10,000 meals flowing through our cafeterias. Really busy retail operation. They've changed, obviously. We've had to close a couple of our locations. So they've been more of supporting staff. So we've had a lot of food donations. They've fed the staff, nurses on MICU, emergency room staff, and other caregivers across the organization. So they're adapting to their new role of being more of a supportive and feeding people when they need it.
And the way we feed people has changed because everything has to be individually wrapped.
Yes. Yeah, so even with donations, so a lot of the donations come in, we make sure it's individually wrapped, whether it's sandwiches or individual pizzas. We deploy the food service team. They're doing a great job to make sure they delegate to those in need. So it's really changed. Even social distancing in our cafeterias. We've had to pull out some chairs and make sure there's separation.
I noticed that. So say a minute more about transport, linen, all the other things,
Sure.
your vast empire.
Yeah, so transport's changed a lot. So what we've decided early on is we had to conserve supplies. So we changed the process to all caregivers use Epic and order through transport, and then we deliver it. So if you need an N95 mask, you need a yellow gown, you need gloves, we take care of that through transport. So they've done a great job also keeping the metrics behind that, how we're doing conserving those supplies, as well as their regular job transporting patients and equipment. In terms of interpreter services, I'm really proud of them. They've evolved into more telehealth and how they're handling that. So on a given day, you'd have 65 interpreters going across the organization. Now they're making more calls over the phone, video, so they're more of a call center operation. And guest support. So early on, when we came out with our visiting policies, they did a great job kind of mandating those protocols at our front desk, and they're doing a great job moving forward.
Well, Dave, I want to thank you and your team, and I personally want to thank your teams who have really been on the front lines of this battle, along with the doctors and nurses and respiratory therapists and social workers. I'm really proud of the work you've done, how much change has gone on. I want to thank you personally, and I want to thank everyone for tuning in today.
Thank you.